Hi, I'm Dr. Smita Ramachandran. I'm a pediatric and adolescent endocrinologist. I'm someone who deals with any hormone problems ranging from diabetes, thyroid, puberty, obesity in children and adolescents. Today I will be talking about obesity and the rising trends we are seeing in the kids today. So what is obesity? Obesity is nothing but accumulation of excessive fat in a child's body. So when do you label a child as an obese or an overweight? So any child whose BMI is more than 23 is overweight, and if the BMI exceeds 27, we call it obesity. So what are the causes of obesity in children? By far the most commonest cause is nutritional. By nutritional, what I mean is that the child eats more food in terms of what he is burning. Either his activity is very less or his intake is too high. Other causes can be endocrine, in which any imbalance of hormones can result in a child gaining a lot of weight. Certain kind of drugs which the child has been taking for chronic illnesses can lead to weight gain. And one of the lesser common causes is genetic causes, when there is a mutation which often runs in families, which can also lead to weight gain in children. So why is obesity such a rising concern in children? That is because it is associated with a lot of comorbidities and complications. Namely, these children are more prone to developing diabetes and pre-diabetes at a very early age. There is also an increased incidence of high levels of lipids, cholesterol and triglycerides in children who are obese. The obesity tends to affect their weight also, which in turn leads to imbalance in bone health, and they have very low vitamin D levels, bone pains which are exaggerated. Another important complications of obesity, especially in adolescents and children, are these children, girls, are at a higher risk of developing PCOD in later life. So we need to understand the associated complications, and they should be prevented by managing obesity at a young age. The question is, how can obesity be managed in children? Well, one of the most common answers that I usually give, first and foremost, it is the lifestyle modification that should be done in managing any form of obesity in children. It is easy to remember this rule of 5-2-1-0, 5 being 5 portions of fruits or vegetables in a day in a child's diet, 2 for less than 2 hours of non-academic screen time. Especially the children should not be allowed to watch any kind of phone, TV, apps while eating food. They should sit, chew their food and enjoy their food. 1 is for 1 hour or more of physical activity every day for a child. And 0 stands for 0 sugars. That means sugar should be eliminated from the diet as much as possible. The leading cause are soft drinks, sweets, biscuits, cookies. Other than lifestyle modification, there are also drugs which are used in children where the above don't work, or when there is an underlying hormonal cause or genetic cause. In such children, we have drugs which help them reduce their weight and manage their hormones as well. For your child, if he or she is gaining weight. If the child, despite all lifestyle modifications, dietary interventions and physical activities, continue to gain weight or fails to lose weight, you must meet one. If the child is progressively gaining weight but continues to remain short or is failing to gain height, you definitely need to meet an endocrinologist, because this most commonly might be associated with hormonal imbalances. These are the conditions. If happening, you should meet your endocrinologist.